Good morning. Thank you for joining us today. My name is Norma Pereda. I'm the Director of Business Development for iPros Insurance Professionals. This morning, I have a very special guest, Johnny Vasquez, Aetna's Broker Manager for LA County. Welcome, Johnny.
Good morning. Good morning.
Good morning. This morning, Johnny will be presenting on Aetna's 2024 benefits. Johnny, the floor is all yours.
The floor is all mine. Thank you very much. So I'm going to get in here and bear with me, folks, and we'll get you all started here. So if we could just set on here on our, there we go. So everybody has my screen there. Let me go back. I'm going to go back one here. So thank you all for joining us. Norma, thank you. Thank you for the folks for iPros for allowing me to come in today. November 1st, right? It's pretty crazy. We've been doing this, 3 weeks now, give or take a few. And we think we got another 4 or 5 more weeks to go. So hopefully you folks who are on the call, if you haven't been certified with Aetna, you get certified today. You got a lot of great benefits available for you. And for you folks who have certified with us already, if you have any of those what-if questions, by all means, give me a call, okay? So this presentation lasts about 45 minutes. If you have any questions, I think we put that in the chat or how that helps out. So we'll be good to go, okay? So I'm going to move forward here. And or before I go forward, let me go back. As Norma indicated, I'm your LA County manager. Anything you need with LA County itself, you can reach out to me itself. If you need anything other than other counties, I can also assist in other counties, such as San Diego, Orange County, Riverside, San Bernardino, Northern California. Okay, so I'm the guy. I'm your main contact. Give me a call. Here we go. So remind you, obviously this is late news, but we want to make sure that you folks know that you're not supposed to go over the plans till October 15th, where today's already November 1st, so this is an old slide. But this one here, we remind you that if you want to get certified with us, if you're already certified, great. It does require that you complete MST. Let me move this over a little bit here. How do I get rid of this little screen there? You see, we good? Okay. So with us, we want to make sure if you're not certified with us, you want to get an invitation from iPros, your upline, to get certified through us for 2024. If you're already certified with us, greatly appreciate it. When you come and got certified with Aetna, it does have a little box that indicates, hey, I'm going to take one of these market-specific trainings, and that's what this is. So this is going to cover all of California itself. So when you certify today with me, you can also count for cover California. I'm just Northern California, Southern California, throughout cover other areas of California itself. If you want to go to other states, we highly recommend. If you sell in other states, you also want to take a market-specific training for that specific state or county, because the last thing we need to do is try to sell a plan and not understand the benefits, okay? So that's us on our certifications and market-specific trainings. So why sell Aetna, right? Great question. So this is Aetna. As you can see in the green color, the big map in the big old state of California, we've expanded a lot of the green areas out there, right? And then you see LA, you realize how small LA is compared to the rest of California. You don't realize how small we are compared to the whole gamut. So we got LA down there, which is a little bit, I think they call that lavender or purple color down by the bottom. But the green areas, people ask us, why do we expand in the green areas? Because you have opportunities up in those areas, such as Humboldt, Tiscue, Mono, where people in LA County, they might decide to retire. And these are plans, in those particular areas, they have fee for service, which is Medicare only, or they might have a Med Sup. And we all know as Med Sup rates go up, everything gets higher and higher as people age. So there's a good opportunity for you to sell our PPO plans specifically in those areas. So I'll go more detailed, but this is more high level of what we're looking at for, right? In the areas that we provide coverage, we have 5.8 million eligibles. We're a national PPO. So if you're not familiar with Aetna, Aetna has been around for more than 150 years now to date. Hard to believe, right? In California, I believe it's more than 10 years been around, but we're a national player, which means that if you sign someone up right now on our national PPO plan or our PPO plans, if they have a procedure, or if they want to see a doctor, or if they want to see a specialist, maybe that it's in Texas, or maybe that a doctor is in a different state, they can use our national PPO network to see that doctor and pay the copays associated with specific county, right? I'll go more detailed that, but I'm just want to remind you that we are a national player, not only in Southern California, we have markets available and opportunities available in other states here, right? We've added for 2024, we do have that LIS plan. It says POS, point of sale. That has to do with our dental. So we've added it to 14 counties throughout the good old California state. And LIS, if you know LIS, that's low income subsidy. And LA County leads California as far as the most opportunities for LIS eligibles in that particular area, right? We have access to member experience. Again, if you know our plan, we have rich embedded dental, we have eyewear allowance, we have OTC, and most of our plans are. And then we have a fitness DMR. So if you folks are on the line there, if you want to write down DMR, we'll speak a lot about DMR. DMR has to do with direct member reimbursement, which means the member pays and they get reimbursed. So DMR, I'm going to talk a lot about that today, direct member reimbursement. Everybody's on the call today. I also send you a recap of what we spoke about and also part of our DMR, what's included with our DMR, okay? We have local broker liaison, which is me, Johnny. I handle LA market. And I'll show you later on some of the folks you can speak to that handle Riverside, San Bernardino, San Diego, even Northern California itself. And then we also have one of the only providers that I know, or carriers that I know, that has a local community lead generator. Pretty straightforward, right? Community lead generator. Instead of you going out to the farmer's market or the city or some senior center and you do all the legwork where you sign the paperwork, you get all the supplies, you pay for the fees. We have individuals that can help you out where they do all the legwork for you and they get you set up with those opportunities. Instead of you doing all the work, again, relieves your time, allows you to just go to sale. And we can talk about it a little bit later during our presentation. We're committed to compliance. We've taken off our HMO platform. If you folks are familiar with the Jimmy Walkers and the Joe Montanas and those types of folks, Joe Namath, who call your clients up and say, hey, switch. So we do not have that platform on that national provider, which means that your clients can't be called up and get switched away from Aetna. Okay, so just a great opportunity. We want you to keep your business within Aetna itself. Some of the new partners we have for 2023 is Allied Physicians, which kind of handles this little general area here, which is also Alpha Care. For new for 2024, we also have Prospect Health, which is going to be available down in South San Diego, and Health Excel. We also have that in LA in Orange County, but this is going to be specific to San Diego. We have Prime Care Medical Group of Chino Valley. Okay, so Prime Care Medical Group of Chino Valley was with Optum, and they've separated. So now we have them available for you folks through Aetna. And that's going to be obviously through the Chino area, kind of Pomona, Upland area that they provide coverage for you. Okay, so this is our plan, and these are what we're looking at for 2024. Okay, so here's a kind of the three new plans we're bringing to market. So we have a core PPO plan, right? So many of you folks have written us before. You know we have a other PPO plan. There is a premium. We understand that other people came to the market that have a zero monthly premium. So now we do have for 2024, we have what we call our core PPO plan, and that's going to be zero monthly premium. It's going to have a rich embedded dental, right? And also, and when it says asterisk, just means varies by county. We have OTC and vision, hearing. We have an annual fitness. Again, we'll talk a lot about that. I did mention to write that down, DMR, direct member reimbursement. And also we talked about expansion into multiple counties in Northern California. So the middle one is the one that's going to be the big one for us in LA County and other counties surrounding, right? So this is our HMO POS Value Plus plan. This is our LIS plan. You folks have been with LIS in the past, whether it's been tier 1, 2, 3, or 4, right? Tiers 1, 2, 3, and 4. They all had copays, and maybe not 3, right? So 1, 2, and 4 always had copays. It doesn't matter the level of LIS. All our prescription drug plans have a zero copay associated with that, right? Rich embedded dental, $1,000 to $3,500. Again, it varies by county. We have a grocery card. So those folks who have LIS are going to have a grocery card access. And that would be places such as like Albertsons, Ralph's, and other facilities. And I'll share that with you in an email too, specifically. Again, that's $40 a month. And then the OTC is $50 to $60 a month, depending on the county you're in. And this is also only we talked about LIS. This is also going to be a great opportunity. Again, great opportunity for those folks who do not have LIS. And I'll explain the reason why you want to put somebody on this plan who does not have LAS as we go through the process. We have the Classic Prime, which is going to be down in San Diego. It's going to be exclusive to Prospect and Health Excel. Rich Embedded Dental, as we talked about, the DMR, and also that annual fitness. Okay, so that's what we have here going through forward. Okay, excuse me, let me get some water. So this is our LIS plan, low income subsidy plan. As you see, it says LA, but it's also available Kern, Orange, San Diego, Riverside, and San Bernardino. It's also available in Northern California, but we're going to speak more about the Southern California market right now, right? So if you look on the right-hand side, it says 0. So if it says 0, that means somebody who does have LAS. Again, it does not matter the level of LAS, whether it's 1, 2, 3, or 4, they're going to pay 0 on their monthly premiums, okay? So as you go down to the right-hand side, 0, 0, zeros, it says $5,999, but you have to realize if you sold a Medi plan in the past, you have to put a dollar amount just in case the member loses their LIS benefits, right? So look on the right side, zeros, and all the way down is going to be, instead of $599, 0, 0, zeros, all the way down to unlimited Cairo, right? I'll speak about that. However, if you, however, you look to the right-hand or left-hand side, you'll see $12. Now, the $12 is there if somebody does not have LIS, one, or if they lose their LIS benefits. As I mentioned earlier, we have to put there per CMS guidelines, if someone loses their LIS benefits, what's available for you, okay? So if they do not have LIS, they would pay $12 a month. If they have LIS, they will pay $0. As you scroll down the screen, does this have a mouse on it? No? Okay, there we go. Thank you very much. Modern technology nowadays, folks, here. So everything down here, all 0, 0, 0, this is going to be zeros. However, if they do not have LIS, they would pay $12 a month. They would have a MOOP. They would have emergency worldwide. And really, somebody hit the 275. I don't know if you folks know, but only about 2 to 3% of the folks out there are ever going to reach this MOOP. On this plan, really, the only way they would reach the MOOP, if let's say they were in the skilled nursing facility for more than, let's say, 10 days, and they actually had a worldwide coverage and they had an ambulance. That's kind of really the way they're all going to read that, because in the hospital stay, you're not getting, it's all 0 across the board. So I'm going to speak about this. We all know this here, right? So I'm going to start right down here. So both individuals, whether you have LIS or not, are going to get unlimited Cairo. And with our services, when we say unlimited Cairo, what that means to you folks is that what's prescribed by the chiropractic or the acupuncturist, right? So if the chiropractor says come once a week, come once a week. If it's every 2 weeks, come every 2 weeks. You just can't come every day just because you want to, right? So unlimited, Ash Network, which is self-referral. Now, everyone's going to get this DMR. We talked about this earlier. I asked everybody to write this down and kind of circle. What that means is that all our plans, going back a little bit. That means all our plans include Silver Sneakers. Silver Sneakers is included automatically with all our plans. However, let's say you sign up a member and they might go to maybe a YMCA, right? Or there might be a private gym they want to go to. So if they want to go to that private gym and it's not available through Silver Sneakers, they can use the $600 to pay for that monthly fee, right? So one of the first companies to come out with this annual fitness of $600. Maybe next year, you might see other players in the market come with this. Get to know Aetna is the first one to come out with this for 2024. So not only gyms that are not available, if you went to a Silver Sneakers website and maybe there's a 24-hour fitness and they have multiple classes available for that individual. And perhaps maybe there's a Pilates class, maybe there's some special training class that's not available for that particular member. They can use this $600 annually, annually to pay for that membership, right? And when we say fitness, I keep on going back, I apologize here. This mouse is tricky. Bear with me, folks, here. So when we say fitness, not only do we mean the gym, we also mean equipment. We say fitness like a treadmill, right? If somebody wants to buy weights, if somebody wants to buy, get this, a fishing pole, tennis, tennis racket, pickleball, if they wanted to buy tennis shoes, if they wanted to buy, for example, maybe a elliptical machine or even an Apple Fitbit watch, they can use this $600 annually, again, annually to pay for these different items. And not only that, if they want to get into classes, there's some like classes they can get into, dancing classes, even national park, state park fees they can get into. And I'll send you folks a little bit later and more in detail, specifically what this gets into, but they're not going to get reimbursed for such things as guns and ammo, those types of things, right? Bicycles, but not the bicycle repair. It also includes golf. So somebody who wants to play golf and their green fees at a public course, it'll pay for the green fees. And it's pretty simple. We talked about DMR, just means that direct member reimbursement. The member pays, right? And they get reimbursed. And I'll give you agents later down the way, the forms a member needs to fill out. And typically right now to get reimbursed, it's about 14 business days to get reimbursed. Okay, so that's our DMR. We'll speak more about it during the way, and I'm sure you folks can put it in the chat and we can respond a little bit later to that. As we go down here, again, this is the LIS plan. So they're getting OTC, $50 a month. Again, $50 a month, which is $600 a year, right? They also get the healthy food card, which is $40 a month. And that would be such stores such as like Albertsons, Ralph's, and there's a whole gamut of other facilities throughout the year where they can buy food itself, right? So if they have LIS, they're going to take advantage of the $40. If they do not have LIS, that's what they won't get. All right. So if you scroll down, transportation, we have PERS. Our PERS is available for not every member. The way they would get it, they would contact member services, and member services would have two questions. Do you live alone, right? Or do you have a fear of falling? If you say yes to one of those, they're going to get one of these personal emergency response systems, right? And the technology nowadays is tremendous. Back in the day, when I started in the business itself, it was structured in the home itself, right? Now, anywhere they can get a wireless signal, they can use this application. So we have two types of response systems. Again, when they call up, they're going to ask them two questions. Do you have a fear of falling or do you live alone? They say yes, right? So they have two options. The first option would be around the wrist, which is a watch, right? The second one is going to be the pendant that goes around the neck. And I highly recommend if somebody has a fear of falling, obviously you want to get the pendant one because the pendant one has a capability to determine when someone actually falls. On the watch, you would have to press a button that said, I slipped, I fall, I can't get up. Around the neck has that capability of being able to detect if someone actually falls down. Okay, so two options around the wrist and also around the neck there. Okay, and then we talked about our DMO. So this is our PPO. I'm sorry. So with our LIS plan, again, low income subsidy plan, right? This low income subsidy plan has a PPO dental network. What that means to you folks is that these folks can go to any dentist nationwide through Aetna. So Aetna has a national PPO dental platform available for them. So they can go to a dentist in LA, San Diego, they can go down to a dentist. Maybe they're traveling and they're in Texas, right? They want to get some dental work. As long as the dentist was in our PPO network, they get $3,000 of $3,000 of benefits available for them. And $3,000, right? There's a lot of other carriers out there that are decreasing their dental while Aetna is increasing their dental. The nice thing about this, they don't have to come money out of their pocket. Obviously, if they go over $3,000, they can, right? But $3,000 is a lot of dental coverage. And the things it's going to cover, again, it's got to have ADA code associated with it, which is American Dental Association code, right? The things it's not going to cover are cosmetic, and also missed appointments and veneers. But implants, yes, implants, folks, dentures, crowns are going to be covered. We're only a company that covers it from the start. So you don't have to wait 6 months and we don't pay 50%. There's other companies that will charge you have to wait 3 months, 6 months. So January 1st, right? You sign someone up today. Obviously, the dental office needs to be open January 1st. So they can make a appointment for January 2nd or 3rd or 4th and walk in the door from day one and start the using the benefits of our dental plan, right? So it's $3,000 of coverage they're going to get through our dental. Now, we also have an eyewear through iMed. So if you're with iMed, if you go to the website, such things as Lens Crafters, JCPenney's, and also Sears Opticals, and there's a lot of individual eyewear optometrists locally. So they would go to iMed. they get their eyes examined, and they get $275 for eyewear. So that's not lenses, that's not frames specific. It's whatever the cost is at $275. And then we also have hearing. Many folks use the Nation's Hearing, so we have Nation's Hearing. So that is $1,250 per ear per year. It's not a copay. Again, it's not a copay. It's per year, which means they get up to $2,500 a year. And that's every year, not every 2 years, 3 years, or 4 years, right? It's every single year your members can use this. So this is our LIS plan for LA County. I went through pretty much every bullet point about this. As we go through some other plans, I'm not going to dive deep into this, but I'll just kind of point out a few bullet holes or bullet points that are a little bit separate that are included in this LIS plan, right? Again, we have Kern, Orange County, San Diego, and San Bernardino, okay? So how to apply for LIS, right? Pretty straightforward. If you want to apply for LIS, you can go to benefitscheckup.org/Aetna. They can go to sss.gov and extra help, right? You can apply for your members over the phone, right? You can go online if you want to physically walk in line, which I don't recommend, right? We're all too busy nowadays, but there's different options available to get your members set up. And normally it takes about 6 weeks. So if you sign someone up, let's say you sign up in December for this plan, and it takes 6 weeks, and their LAS is not available until February 1st. Obviously, the first month of January, they have to pay that $12. So you want to make sure you tell your clients once LAS is available, then you're going to see it be at $0, right? And then to confirm, how to confirm, you can also go through our member services. I don't know what platform you folks have, but I'm sure you can go through your own internal platform to find out if someone has an LAS, or you can go through our Think Agent. Again, Think Agent is Aetna's version of like Connecture, Sunfire, where you can do enrollments. It's our own branded, so you would go through. It's a CRM. You put all your clients. You can enroll somebody through our Think Agent, whole gamut of things. Not only that, you can also verify that if somebody has LAS. And you can also go through and request CVS stores. We could talk a little bit on, but as you know, CVS is owned by, or Aetna is owned by CVS. So if you ever want to go to CVS stores, you can go through the Think Agent and secure the locations, right? We talked about the opportunity throughout California itself. We have 1.8 million eligibles in California, and LA leads the market with that. And this also gives you a year-round selling opportunity. And you know that because in the first quarter, they have an opportunity. The second quarter, third quarter, and even the fourth quarter, obviously you got to follow the guidelines for AP. So if you don't get anybody signed up during AP now, and maybe you run across them during the second quarter of next year, there's an opportunity to get them enrolled in this LIS plan, okay? So move forward. So this one is side by side. This is LA County. And the reason why I put this LA County, because I'm from LA County, right? So this is our plus plan. This is new for 20, the green is good. Green's good, right? So the plus plan for LA County has been around for some time now, right? So what we've done is we lowered the MOOP. Excuse me. It was $8.99. We lowered the MOOP to $5.99, right? We went over the numbers, 0, 0, 0s. This is the regular one. And we've added the fitness. We talked about the fitness. So this plan has that DMR fitness. Remember, $600 annually they're going to get, right? We have the OTC of $105. We have the transportation, the PERS. And I'm not going to go through all this stuff here, more of the green things that are highlighted, because we talked a lot about this during the LIS plan, right? So we have the dental, DMR. We talked DMR. If you're familiar with our plus plan, which is available now, DMR means direct member reimbursement. This one, there's no network whatsoever. So if you sign up a member up on this plan, make sure you emphasize to them if they ever go to the dentist's office, not to show an Aetna card, because they're going to tell the member you don't have dental coverage through Aetna. Then they're going to call you up and say, you know what? Hey, Johnny, there's no dental. I know it's not a dental plan. It's a reimbursement. So if you put them on the plus plan, right, it's a DMR, direct member reimbursement. Remind you, they pay, right? They pay for the dental. They're basically a cash patient. They get the receipt. They get the invoice, show proof of payment, and they would submit, and they're going to get reimbursed. And that's a dental we talked about earlier. Things it does cover, does not cover. We already went through that. And then we also have the DMR for the eyewear, direct member reimbursement, right? So the eyewear itself on this plan, they have to go through iMed. Again, they have to go through iMed for their eye exams, right? And they can go out of network to get their eyeglasses, frames, whichever. And out of network would be such places as like Costco, or maybe somebody wants to go to like Warby Parker, could be out of network itself. So they go to iMed for their eye exams, and they can go out of network or in network for their eyewear. That's what it says DMR. So on the right-hand side, we do have this LIS plan. The reason why, let me go back here. The reason why somebody would pay $12 a month who does not have LIS, remember, LIS pays $0, right? However, why would somebody want to pay $12 a month who does not have LIS? The big point is going to be, the big fan is going to be the dental, right? This one is great, $22.50, but it's a reimbursement. That means they have to pay out of their pocket and get reimbursed. Many seniors are on a tight budget, right? So why not offer this plan for those folks who do not have LIS and LIS for $12 a month, which is $144 a year, right? Pretty nice. They're going to get access to this dental to $3,000 of coverage. It's a PPO network, right? This one, there's no network whatsoever. This one, there is a network, which means, hey, if I pay $12 a month, I'm going to get access to a PPO dental network, not an HMO, not Liberty, not Delta Care, whatever. So this is our Aetna PPO dental network, up to $3,000 of coverage. And we talked about us being a national player. So if they had a dentist in Northern California, if they had a dentist in Texas, as long as that dentist is part of our network, they can actually go to see this dentist. So that would be one of the big reasons that you offer your member two options. Hey, do you want to go on this plan? On the Plus plan, you got to pay for your dental reimbursed, or do you want to pay $12 a month, which is very, very low. I don't know any other dental plans out there. You pay $12 a month, even standalone. $12 a month, you get $3,000 of coverage, and it's covered from day one. So that's one of the big reasons why you would offer this plan to somebody who does not have LIS. A second is going to be, this one offers $50 a month in OTC, which is $600 a year. This one is $105, which is $420 a year, right? But one of the things I want to point out here is that if they do not have LIS, they're not going to get the food card, right? So I jumped over to Orange, same concept as LA County. We have the Plus plan, right? I believe you folks sell in the Orange and LA market. We have the Plus plan, which is virtually the same numbers. I won't go through it all. But in Orange County, we have a plan which is called the Prime 2 plan. So if you sold in Orange County in the past with Aetna, we got that Prime 2 plan. So the Prime 2 plan is exclusive. Again, this is exclusive to the Prospect Medical Group, Providence, which is St. Joseph's, St. Jude's, and also Memorial Care, right? So this is exclusive to them. As you see, it's virtually the same as the Plus plan, except they get more money, right? But for some reason, people say, hey, Orange County is more expensive. I still want to argue that LA is still just as expensive as it is in Orange County, right? But same concept here as a Plus plan, Prime 2 plan. They get $800 annually on the fitness, and they get more in the dental. Again, that's a reimbursement of $3,000, right? You'll see them side by side. They also have what we call the LIS plan, same like LA County. However, in LA County, it's $12, and in Orange County, it's going to be $15. Same concept. If they have LIS, they pay $0. If they don't, they pay these co-pays. What's going to be different is that they also get a little bit more money in Orange County for the dental, $3,500, and also eyewear of $350. Okay, so I'm going to move forward, not jump on that. Any question at this point, or how do we go forward? Just keep on going. Yeah. Okay. And then this is our PPO plan, right? So we have our core PPOs. So if you're familiar with Aetna, and then we have two. We have the HMO plans, and we also have a PPO. Now we've added a second PPO. So this is the new core plan, which is going to be available for you folks come 2024. So this is a great plan for someone's on Covered California, right? So Covered California, they're aging in. They get into Medicare, they got all those premiums. Look at this plan, right? Or someone's coming up group insurance. They probably pay high premiums. Or even if someone is on a med sup, we all know med sup rates go up every year. And we all know medications are going up every year, right? So this is an opportunity for somebody to say, you know what? Hey, I might be looking at this Aetna PPO because they want freedom. This gives them freedom. So it has in and out of network. So I'll touch a little bit on basis. So it's monthly premium is $0. It has deductible 0, right? In and out of network. INN means in network. OOM means in and out of network, right? So it's got a MOOP of $8,900. It has a hospital of $350 per day. So in LA County, again, LA County, these are the big hospitals that are in network, and I'll touch a little bit on Orange County. So in network with us on our PPO are going to be USC Keck, UCLA, Ronald Reagan, Torrance IPA if you're out in that neck of the woods, right? You also have PIH, which is across, the bridge there from us. You also have Eminent, which is also part of our PPO network. So if somebody wants to go one of those hospitals and have a surgery, I highly recommend you look at this core plan, right? LA County, those are the ones. I'll send you an email. There's much, much more hospitals available for you, right? And in San Bernardino, Riverside, you also have, you have Loma Linda, which is in network for us on our core plan, right? And in Orange County, you have Hoag Hospital, which is going to be one of the obviously top hospitals throughout Southern California. So this is the reason why if someone goes to those hospitals and they want to get a PPO plan, this is the plan you want to get them enrolled in, right? 0 monthly premium, 350, days 1 through 4, $350 a day. It tells you about the skilled nursing facility, outpatient surgery, in and out of network for copays for doctors. But I want you folks to look at where it says out of network at 40%. Write that down. I'm going to go a little bit on the reason why we want to look at the other plan. So 40% for out of network and 40% for out of network for outpatients, say, right? We'll talk a little bit later, but I kind of want you folks to write that down and we'll talk a little bit later. So as we go down, you can see the numbers, x-rays, labs, Cairo, it's not covered. They have OTC, which is $45. Again, this is a PPO, right? Not like the HMO stuff. They get that $600 annually. They get that $600 annually for the fitness we talked about on the plans. They also get dental. So it's $1,000 in dental. Yeah, a lot of not like the HMO, but it's $1,000. So 180 means that if they stay within network, which is again our Aetna PPO dental network, it's $1,000 of coverage. So they're going to get up to 100% of coverage on the dollar amount if they stay in network. Now, if they go out of network, they get 80%. They're going to get reimbursed at 80% increments. So what that means, if they went out of network and the bill is $1,000, they would submit their paperwork. They're going to give them $800 back. They still have $200 to play with, right? Out of network, you get reimbursed at 80% networks. In network, you're 100% there, okay? We have eyewear and also the hearing, right? This is what we got in place here. So this is our core plan that's going to be brand new for 2024. Here's a San Diego market side by side. And then we're going to move ahead. So now this is the existing choice plan. Green means good. Green's always good, right? So we've lowered the premium. It was $87 and now it's $77. There's no deductible. It used to be a $750 deductible, right? And then as you can see all the things that are green there. So I'm going to point out 6 different things or 6 different bullet points that are different from the core plan, right? As compared to the choice plan, just 6 different things. Everything else is the same. So the first thing is going to be, or the first item is going to be monthly premium. Sorry, bro, this keeps on going back. I'm sorry.
You can use the arrows.
I just want to kind of go over. So we have $77, right? So this one has a monthly premium of $77. The core has 0. Now, if we look at the OOM, which is the outpatient, right? I ask you folks to write that down. So previously the outpatient has 40% on the core. This one has a fixed cost on out-of-network hospitals. So out-of-network hospitals for us in LA County, a little bit about Orange. What's going to be out of network with us is going to be City of Hope, right? And Cedars-Sinai, right? City of Hope, Cedars-Sinai is out of network. There's a few more out there. And also in Orange County is UCI. So if your member says, hey, you know what? I need to have a procedure done and I want to go to City of Hope. This is the plan you want to get them on. If you put them on the core plan, that has a 40% co-insurance for out of network. You don't want to do that, right? So if someone had to go to Cedars-Sinai, which is one of the top hospitals in the United States for cancer treatment or some type of treatment, right? And they're in the hospital for 10 days, they're going to pay $4,250. That seems like a lot of money, but relatively speaking, at that top-notch hospital, you're probably going to spend about $4,000 a day if you didn't have coverage or you had to go to Covered California, right? So this is going to be a great plan for the folks that are going to be out of network. And then days 11 through 90 are 0. So that's a third call out. The fourth call out is going to be the outpatient. So the outpatient right here is if you look down the screen, I'm not going to move this anymore because it keeps on going forward. So it says outpatient is $450 per day, right? The other one is 40% co-insurance per day. So that's the fourth call out. The fifth call out, unfortunately, is that this plan does not include the fitness $600. It includes silver sneakers, but it does not include the fitness of $600, right? The fifth call out is going to be the dental. The core plan that we spoke earlier has $1,000 of dental. This one has $1,500 of dental. And the same concept right here, right? It says 80, 100. So if you go down here to an 80 and 100 in network, they get up to 100% of $1,500. If they go out of network, they get reimbursed at 80% increments, right? So that's the fifth call. And the last call out we're going to look at, which I didn't go over previously, they're on two different formularies. The core plan previously that we spoke about is on a B3 formulary, and this one's on a B2 formulary. It's not listed here, but I'll put that out. And then when you folks get our applications, you look, I think it's on page 9, it'll give you the formularies for each of the plans. And speaking about our applications come with all the plans available for you. So when you go to the application towards the back, you can just check the box on which plan you're going to get in there. Okay. So this one here, when I talk about the formula, this is a B2 formulary. The core is a B3. B3 just means that tiers 1, 2 are copays, and then tiers 3, 4, and 5 are co-insurance. On this plan, which is the choice plan that we're speaking about now, it's on a B2 formulary, which means tiers 1, tiers 2, 3, and 4 are copays, and then tier 5 is co-insurance. Okay? So that's the big 6 call-outs. And I'll send you the evidence of coverage. You can look it all over. Everything is virtually the same. Again, the 6 call-outs, what makes this different is that this one has a premium. There's also the fixed costs for out-of-network hospitals, fixed costs for outpatient. The choice plan does not have that fitness benefit. There's more on dental and also the formulary, right? Remind you, if somebody wants to go to out-of-network hospitals, you want to put them on the choice plan, right? If they want to go to in-network hospitals, you want the core plan, all right? Any questions on that? You can always ask me a little bit later down the way. So I'm going to skip ahead here. Now it doesn't want to go forward. What are we doing here?
Arrows.
There we go. And then one of the last plans I want to speak to you about, folks, are, and we have training on this. So if you're familiar with Aetna, we have our Eagle Plus plan. So the Eagle Plus plan is specifically for somebody who has TRICARE or CHAMP VA. We've been told in years past, stay away, stay away, stay away. This is a PPO plan. This is the 4th year that Aetna's had this plan. 3rd year in LA County, but we've had it throughout other states. This is our 4th year, I believe. So we've cut our teeth, we made the mistakes, and we perfected this, right? So when someone signs up on this plan, we become primary, right? We become primary. So there's training happening. If you folks want to go on Aetna's agent or Aetna Medicare agent training platform, you'll get a scan on that. You can go there. We have training on that goes over our Eagle plan. And I'm just going to go highlight stuff, but we can become primary with us. So if there ever is a claim, they would go through us, through Aetna if there's any claims. So what happens is that if they stay within network, they obviously would pay the bill. There's a code they could. So for example, let's say somebody went to UCLA and they were on this plan, on the Eagle Plus plan, TRICARE. So went to UCLA hospital and they were charged for the first 4 days, right? So the first 4 days is $430 per day. So that's about $1,700. So they would pay that bill, right? And then they would turn around, they would submit it to TRICARE Champ VA. And TRICARE Champ VA would reimburse them the $1,700 and some dollars, right? The reason why, we become primary. So TRICARE Champ VA, being where considered primary, they'd rather pay the $1,700 for this claim than be responsible. Because if they were primary, if they had a claim, we're talking $1,700 is nothing compared to someone who had to go to the hospital and they're in the hospital for 4 days. It's probably going to be about $10,000 at least. So they would be on the hook for that. And there's training on this. We'll go more detail, but the idea is that we become primary on this plan. Some of the things I'm going to scroll down towards the bottom here. If you look at the fitness, so these are the points or benefits that are not going to be available for somebody who's on a TRICARE Champ VA. Again, to be on Champ VA or TRICARE, you have to have A and B. If you don't have A and B, you can't be on TRICARE or Champ VA. Just like this plan, you must be on A and B, right? It's all Medicare. We took that in our AHIP class. You got to have A and B to get on a Medicare Advantage plan or a Medicare PPO plan, right? So this is a Medicare PPO plan. There are no medications built into this, right? They would go through their medications through the VA. No PPO. This is the MA only, no medications. So here's some of the things they're not going to get. And it's happened where people or veterans or military folks have joined this plan and they only use this for the benefits. And they'd rather go to TRICARE hospital, which is fine, right? So some of the things they can get, they're going to get the OTC, which they're not going to get through Champ VA or TRICARE, right? $105. They're not going to get that Chiro, right? They're not going to get that fitness. Again, we offer that DMR fitness. This one is $150 a quarter, which is a little bit different. It's still $600 a year. So they're also going to get that DMR fitness. They're also going to get post-discharge meals. I've tasted these. Are really, really good. They're not frozen. So someone gets out of the hospital, they can request these meals and they come freshly vacuum sealed in a package. In my understanding, they could sit on someone's porch for about 3 days. Put it in the fridge. If they want to freeze it, they can, but it comes out fresh. And these are really good. They can be specific to any diet or nationality you want to go to, right? Yes, it's not transportation. No PERS is not offered, but they also get the dental network, right? We talked about our PPO. So this is a PPO dental network. We saw that on the core and the choice plan. So theirs was $1,000, $1,500. So this was the $3,000 in dental. We talked about the concept, 100% or 80%. In network, up to $3,000 of coverage. If they go out of network, they get reimbursed. So they can get a dental plan through TRICARE or Champ VA, but it's not as comprehensive as this. And it also costs them money. So again, this plan doesn't cost them money. And we're also giving a Part B $25. They also get eyewear, $300. And they also get hearing of $1,250 per year. So these are the great benefits available for those folks. So if you're a little leery about signing someone up on a Champ VA or TRICARE plan, again, we have some training happening this month through Aetna, and we also have the month of December that speaks specifically about the Eagle plan and how that works, okay? So I'm gonna skip over to you on this one. Extras, kind of wrapping up here. Here's a DMR, we talked about that reimbursement. So here are some of the things that it does include. Membership fees to health clubs, right? Does not participate in silver sneakers like the YMCA, right? Aerobic classes, right? If they want to take an aerobic class, or if they want to take some personal lessons, coaching, that's not available through Silver Sneakers, they can use this. Also fees associated with camping. If they want to buy a camping tent, yes, a camping tent, folks. If they want to buy a hiking pole, fishing rods, tennis rackets, pickleball, the whole gamut of things they can purchase. Also such supplies as yoga mats, weights. And we talk about weights, we talk about the dumbbells, we talk about a whole gamut of weights there, right? Wearable items such as tennis shoes, running shoes. It's not going to include clothing, right? Such as the Lululemons or the Adidas sweats or those types of things, but it's going to include tennis shoes. So they can purchase those tennis shoes and also tracking devices like an Apple Watch, right? Fitbit watch. Again, it's $600 annually in many counties, and some will be $800. So if they bought an elliptical machine, and let's say elliptical machine was $1,000, they're going to submit their paperwork. They're going to get reimbursed by $600, right? So this is what's available. What's not included, we talked the right-hand side, social clubs, the nightclubs, they can't go to nightclub, gun clubs, shooting clubs, athletic clothing, they can't do that. We talked about that. Also bicycle maintenance. You can purchase the bike, but it won't be the maintenance. So this is what's available. We talked about we're one of the first companies to come out with this, and you'll see a lot of other folks, I bet you, for next year, but this is what's offered through Aetna as our fitness DMR reimbursement. I just want to touch a little bases. Last couple slides here. We talk about our dental. We have 3 types of dental plans, right? So again, you folks will get this, the presentation, but on the right-hand side, on the left-hand side, you're going to see where it says, this is the one you sign up on the Plus plan. It varies by county. They pay up front, right? As we talked about, they pay up front from any dentist, licensed dentist in the United States, and then it's a reimbursement. And these are the services it does cover, right? Things it's not going to cover are going to be cosmetic, teeth whitening. So this is basically on the Plus plan, direct reimbursement. Now this one is the PPO. We talked about 180. General concept on that. This is what they're looking for. So I speak about that again. We talked about the polls, all this things that are available. This is what's going to be available in the reimbursement. Thank you, sir. And now here's the dental. We're good to go on the dental then? Okay. So as you folks see, the dental on the left-hand side is going to be the Plus plan. We talked about what you can get. They pay up front. This is the Plus plan. It varies by county, right, from any dentist, and it's a reimbursement, right? And then these things it does cover: crowns, bridges, extractions, root canals, dentures, implants, right? Implants, dentures, crowns, right? From 100% right off the bat. You don't have to wait 6 months or 3 months. And then it does not cover teeth whitening, as we spoke about, right? So this is the PPO plan that we have available. We talked about 80 and 100, which means that they stay in network. If they stay in network, they get up to they get 100% of the coverage of the dollar amount. If they go out of network, then we reimburse them at 80%. And the one on the right-hand side is the LIS plan, which means that they must go to an Aetna provider, a PPO dental provider, to get coverage. It varies. It says $3,500. Varies on the county itself. They go to a provider through Aetna, and they don't have to worry about money coming out of their pocket, unless obviously they go over the dollar amount. But folks, I put this out there for you. If somebody really wanted to use this plan and want to go out of network, they could go out of network on this LIS plan, but they would have to get reimbursed, okay? But if you're going to put somebody on this LIS plan, just make sure they go in network, right? Because many seniors are on a tight budget, as many of us are nowadays on a tight budget. Say, you know what, if you go within and find a new dentist, and they probably go to the dentist once, twice, every 5 years, only when they really need to. So they're really married to that dentist. So why not find a dentist that's part of a PPO network, and they get up to $3,000 of coverage in LA and then $3,500 in Orange County, okay? Now the eyewear, we talked about the eyewear, DMR, direct reimbursement through iMed. Here's the OTC card, the last things we'll kind of follow up on. So all members, on the right-hand side, you're going to see the white card there, right? So the white card on the right-hand side on your screen, all members are going to get that card. It's going to have a QR code on the back, and the QR code is in place. So if a member calls you up and says, hey, Johnny, what are my benefits? So they scan that QR code. It's going to tell them what their summary of benefits are. It's not going to give them a running total, but it'll say, hey, your OTC is this, your doctors are this, your eyewear is this. So they scan the back of that card, and it's going to give them their summary of benefits. So all members are going to get the card on the right-hand side. If you're a PPO member, you're only going to get one card, and that's going to be the card on the right-hand side. And that's going to have, you know, when they go to the OTC, they would just show their card, their dental, everything's included on that particular card itself, right? However, if somebody is signed up on the LIS plan, which is the one in the middle, they're going to get this card, and they're also going to get this card. So now this is the one for nation's benefits. So if somebody has LIS or gets on the LIS plan, they're going to get this card. And this has the food built into it, and also the OTC. Remind you, if they do not have LIS, they will not get the food downloaded into this card itself. If they have LIS, they're going to get the one in the middle and also the one to the right with a heart on it. There's a purple heart. That is a heart. That has OTC products and also food. If they just get on the regular Medicare plan, the Plus plan, they're going to get this plan. They're going to get this card, which is called the PayFlex card. And they could, that would allow them to get their OTC, right? So you folks know we're owned by CVS. CVS owns us. They can go online to order their products, right? However, they go in the store, they can also not only get CVS products, they can also get name brand products available for them, okay? So I'm going to jump ahead. This is kind of the last slide here. Now, I talked about different folks. This is Art Coomer, who's our Chief Medical Officer. We have Brian. We have Lisa Montador, who's my boss. And then we also have, if you want to find out about the San Francisco Bay Area, this is Esther Magnus. She handles Northern California. We have Shannon, again, who handles Central. And then we have Tyler Brooks, who handles the San Diego market, right? We also have Nikki Valdez, who handles Orange County. So many of you folks in there. And then we have Marcy, Central Valley. We have me, Johnny. That's obviously what I look like with a tie on. That's me. The best way to get hold of me, folks, as you folks are very, very busy, just as I am, the best way to get hold of me is call me on my phone. If I don't pick up, the best way is just text me and I'll respond back to you, okay? Just like my phone is ringing right now, I apologize. And then we have Mr. Sean Bowles, who handles the Riverside in San Bernardino County, kind of apropos, as I talk about, you call me on my phone, it does ring there, right? And then that QR code that's on the bottom, you could scan that QR code, just as you folks obviously got a link through iPros, but in the future, if you want to get additional trainings through Aetna, you can scan that QR code and it'll direct you to any specific trainings you have available. And that's it on our presentation. Any questions? We're out there?
Yes, we do have some questions. I'm not sure if you touched on this, but for transportation, is there a mileage restriction or a limit on the mileage?
My understanding is 75 miles from where they're at. It can't go out of San Francisco.
Okay, perfect. The other question would be regarding the healthy food card. Mm-hmm. What stores can they use the card to buy food? Yeah,
so they can use Ralph's, the big ones, Ralph's, Albertsons. I'll send you the list of those where they can get the food itself. And there's some other smaller stores that are in the general area, but we're getting that updated as we speak. So the one I have is for 2023. We'll get that update to you folks the next week or so. But again, as the top of my head, it's going to be like Ralph's and also Albertsons, of the big stores we have available for them.
Perfect. The other question, let me look at the notes here. The other question, because I'm sorry for everyone that joined today, we had a little technical difficulty with the presentation. But as you were going through the items, do you have the list of what's covered in the fitness plan? Mm-hmm. Or the fitness benefits? Okay. Were those listed in the presentation by any chance?
This is, if I go back, this is a smaller version. Can you guys see my screen?
Yeah, we can see it.
I can expand on that, but there's a longer version I can get, which is like 3 pages in length. And I'll send that to you folks, and you can disseminate to the agents. But at the end of the day, it's things that keep them active, like treadmills, bicycles, roller skates, rollerblades, fishing poles, tennis rackets, pickleball, tennis rackets, even dance classes, right? There's even state park fees. Someone's an RV, right? They go to pay the state park fees. They can use that money to pay for that. What it's not going to include with things such as, guns, ammo, things like that, that would obviously harm somebody, but also green. Like if someone wants to play golf, not private golf courses, but like public golf courses, they can use golf balls, golf shoes, golf clubs. So a whole gamut of things they can offer. This one just kind of a snapshot, but I said I'll give you one that's got like 3 pages of coverage for that.
That would be perfect. Mm-hmm. As far as this presentation, are we able to distribute to the agents?
Yeah.
Yeah. Okay. Perfect. So we'll go ahead. For everybody that couldn't join, we are recording the session, so we can send that out when we send the communication. I don't see any other questions. Johnny, thank you so much for the presentation. Norma, I don't know if you have any questions.
No, again, thank you so much, Johnny. We appreciate all the great information you provided for us again. And if there's no other questions, we'll see you all in the next session of iProsTV. Everybody have a nice day. Thank you.
Thank you all very much. Thank you, guys. Appreciate it.